Joining me are the co-chair of the work group, Marcus Kettler, and work group members Jeff Block and Linda McCann. They are three of the experts who led this update. It covers bone imaging, new therapies, management of calcium and phosphate, and PTH lowering.
I am a big fan of the Rockefeller Outreach Lab. It's inspirational and motivating. I think it's important that students are able to see people that look like themselves, who are doing something that they might not have originally considered was for them.
Lab Out Loud is bringing science to life, and all of the different things, like tonight was about failing better and learning to deal with failure and learning how failure is actually incredibly important in the process of doing science.
We're excited by the advances that we've made in islet cell encapsulation and delivery, and we've got a lot of very exciting data suggesting that these new devices may allow cells to live and function.
The new guidelines come out from the U.S. Preventive Task Force regarding statins is a little bit different than other guidelines because as far as cholesterol management, they're saying that people who are over the age of 76 years, whether or not they benefit from statins remains unclear.
Many approaches to type 1 diabetes have focused on the immune assault in the beta cell, and that is critically important. But another aspect has to do with how robust the beta cell is.
I was tasked with trying to come up with meaningful changes that one can make to help in the care of dialysis patients. And I think the big ones that sort of came up is taking care of patients during transitions of care, making sure that they're assessed as soon as they get out of the hospital, making sure their medications are right and what you think they are. Checking out people who have diabetes in particular, looking at their feet, making sure they don't have any wounds, making sure patients have advanced directives and that they actually know what that means.
I really feel that KDIGO has the opportunity to improve outcomes for our patients. It allows us to look at the science of bone and mineral disease and other issues that affect kidney patients, and it allows us to come up with guidelines that can be utilized throughout the world. When we do similar therapies throughout the world, that gives us the opportunity to see how well those therapies work. And by doing that, we can fine-tune the therapies that we use to improve our patient outcomes. So it's critical that we have this international collaboration, and KDIGO does that for us.
The work that we're doing in the laboratory, we need to explain it to people. That it has to be, and it is easy to understand. We're trying to help people. We're trying to make sure that people who are, in this particular case, suffering from type 1 diabetes can, at some point, don't have to worry about this anymore.
And if you have mild asymptomatic hypocalcemia, especially associated with the cinacalcet treatment, you can probably better leave it than supplement. Still, if you have a patient who is severely hypocalcemic, symptomatic, or has progressively rising PTH levels, you have to do something about it.
T1D is when the pancreas stops working and the beta cells don't give yourself insulin. When I grow up, I would make a machine that kills everything that kills the beta cells and gives you new beta cells that work. But I need a lot of beta cells.
I think I sometimes sort of waffle between feeling like I got this made and this thing has totally got me around the neck and holding me down.
Type 1 diabetes is a family disease. It never occurred to me as we were dating, and then of course the longer we were together, the more I understood.
You have to take care of yourself and also be the patient.
Diabetes is a lifelong condition. It does not discriminate.